Hello and welcome to the Alcohol Recovery Show, where we discuss practical, actionable steps for anyone who wants to achieve their dream of getting and staying well, happy and free from any form of alcohol dependence. Hello everyone and welcome to the Alcohol Recovery Show, the podcast that's here to support you on your recovery journey, offering insights and information to guide you every step of the way. I'm your host, Antonia Ryan, and today we're tackling a fantastic listener question. They asked, is alcohol use disorder a brain disease? So this question came in from one of our listeners, and it's really a really important one. Whether you're on your alcohol recovery journey, whether you're just curious, or whether you simply wish to cut down, understanding the connection between alcohol and the brain is crucial, especially when it comes to recovery. In today's episode, we'll be diving into how alcohol impacts the brain, why it's not just about willpower, and why recognising alcohol use disorder as a medical condition can make all the difference. But now this is important. Before we get into it, I want to remind everyone that this episode is for informational purposes only. It does not replace qualified medical advice. If you're concerned about your drinking or someone else's, it's always a good idea to speak with your doctor or a healthcare professional who can provide guidance tailored to your individual situation. And if you're looking for more practical tips, check out the books on alcohol recovery by Lewis David and by myself, Antonia Ryan. You might find some helpful advice there for navigating recovery, and I highly recommend checking them out. So first off, what is alcohol use disorder? Alcohol use disorder, or AUD, is a medical condition characterised by an individual's inability to control or stop drinking despite the negative impact it has on their life. The condition is classified as a substance use disorder by the American Psychiatric Association and is listed in the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5. AUD isn't simply about drinking too much or drinking too often. It's about a pattern of behaviour that significantly disrupts a person's life. Individuals with AUD often experience cravings, tolerance, that means needing more alcohol to feel the same effect, and withdrawal symptoms when they stop drinking. What's critical to understand is that AUD is not just a behavioural issue, and it certainly isn't a lack of willpower. It's been classified now as a brain disease, and that's what we're going to explore today. But why is this important? Well, it's important because understanding that AUD is a brain disease can help shift the narrative and provide the right perspective on treatment. The brain science behind alcohol use disorder. So what makes AUD a brain disease? To answer that, we need to dive into the brain science behind alcohol and how it impacts brain function. Well, number one, it affects the brain's reward system, and that's what we're going to talk about now. The reward system in the brain is primarily regulated by a neurotransmitter called dopamine. We've all heard of dopamine nowadays. That's responsible for our feelings of pleasure and motivation. So when we do something pleasurable like eating ice cream, exercising, and yes, drinking alcohol, dopamine is released, creating that feel-good feeling. And alcohol in particular stimulates the system, making people feel euphoric, relaxed, sometimes more social. But however, over time, alcohol completely hijacks this system. That's why alcohol can seem like a very false friend if you started drinking due to social anxiety or just to get through parties or talking to people. When someone drinks regularly, the brain becomes dependent on alcohol for dopamine release. the mesolimbic pathway, which controls pleasure and reward, starts to adjust. And over time, the brain requires more alcohol to achieve the same pleasurable effect. I appreciate this is probably not news, but it's just to put it into context and understand that this phenomenon is called tolerance. And it's one of the key reasons why people with AUD need to drink more just to feel normal. Now, another part of the brain that plays a big role in AUD is the prefrontal cortex. I'm really sorry, I'm a bit of a brain psychology nerd. I don't need to get hung up on these different terms, but it really just helps in understanding AUD as a brain disease. So this area of the brain is responsible for functions like decision-making, impulse control, self-regulation. So it helps if we're, say, in a situation where we could get into an argument with a shopkeeper, rather than just go for it and start shouting and giving off. That impulse control helps us just take a moment, just take a breath, calm down, and respond calmly to whatever the issue is. That's our prefrontal cortex coming into play. In short, it helps us make good choices and avoid risky behaviours. So when a person develops AUD, this prefrontal cortex, with all of those skills, the decision-making, the impulse control and the self-regulation, they'll become impaired. This means that people may struggle to make healthy decisions about their drinking, as well as just everyday functioning. They might know that drinking is harming them, but they can't stop. It's like trying to fight a battle with one arm tied behind your back. So alcohol also impacts the dopamine receptors in the prefrontal cortex, leading to this impaired judgment and this reduced impulse control. And it contributes to the compulsive behaviour associated with alcohol use. That's why it's so difficult for individuals with AUD to cut back or quit, even when they know the consequences. This whole pattern is like a domino effect, and it undermines our efforts to stop drinking. So there's another kicker here. There's another part of the brain that plays a key role in alcohol use disorder, and that's called the hippocampus. The hippocampus is involved in memory, learning, and emotional responses. If you're anything like me, when I'm trying to learn something, if I can attach it to some sort of emotional response, if I'm happy and relaxed in a class, or if I laugh when I'm learning something, that can help me remember it. Or sometimes, perhaps it might be the opposite, that you can't get particularly unhappy memory out of your brain, out of your memory, because it's attached to that really intense, unhappy feeling. That's the hippocampus in play. But when someone drinks heavily over an extended period, alcohol damages the hippocampus, leading to memory problems. This can result in blackouts, poor memory recall, and learning difficulties. People may also find it harder to remember the negative consequences of their drinking, reinforcing this cycle of addiction. The changes in the hippocampus also affect the ability to learn from mistakes, leading to repeated behaviours despite negative outcomes. So if you've ever been in the situation where you've woken up the morning after the night before, when everything's just been a complete disaster due to your drinking, and promised that you would never drink again, this is probably the impaired hippocampus now coming into play when you actually do go and lift that drink again. And number 4, we're going to talk now about the stress response. Now, there's a little part of the brain at the back called the amygdala. The word amygdala is related to Latin for almond because it's almond shape. It's really, really tiny. But the amygdala controls emotional reactions, and it plays a significant role in how we respond to stress. In people with AUD, alcohol consumption can lead to increased anxiety, depression, and stress sensitivity. That sense of anxiety, fear the morning after the night before. That'll be the amygdala working in overdrive. And in addition, alcohol impacts cortisol. I'm sure you've heard of cortisol. It's the body's primary stress hormone. chronic drinking can cause a hyperactive stress response where alcohol becomes a coping mechanism for managing anxiety or emotional pain. That's why so many people with AUD drink to self-medicate. So it sort of self-perpetuates this whole pattern of drinking too much and too often. So I've been talking about all of this today to help you understand how alcohol use disorder is a brain disease, and by understanding that, it can be a key to overcoming the stigma that often surrounds addiction. If we recognise AUD as a medical condition, we can approach it with empathy and the right treatment, just as we would for any other chronic illness. When people hear brain disease, they often think of genetic predispositions, and they're right. Research shows that genetic factors contribute to the development of AUD. People with a family history of alcoholism are more likely to develop the disorder themselves. But the puzzling thing is that genetics is just one piece of this overall picture. There are also environmental factors like stress, trauma, and social influence that contribute to AUD. So just because you have an uncle that sadly passed away early in life due to drinking too much doesn't mean necessarily that you will have alcohol use disorder. But all of these factors, the environmental factors that we talked about like stress, trauma, social influence, interact with the brain's biology to create a complex network of causes that lead to addiction. I talk a little bit about this in my book, The Alcohol-Free Woman, and I compare it to one of those combination locks. You know those locks that sort of click round? There might be a few different numbers on it. You've got you set the combination. And when you click the lock to the correct numbers, it unlocks. It can be a bit like that with alcohol issues. You might have one number that's set in the correct place, so to speak, but if you don't have the others, it won't open up. If you have all of them all lined up, the lock is going to open up and open you up to alcohol use disorder. So the complexity of all of this, brain biology combined with environmental factors, is why it's so important to treat AUD holistically. It's not just about cutting back or drinking or going to rehab, though these things obviously help. But if we want to sustain long-term recovery, we need to address the brain and help it heal. So now I'm going to talk about treatment approaches for alcohol use disorder. If you're interested in this, Lewis David does talk about this in his book, Alcohol and You. Check it out if you're interested. So this segment, we're going to talk about how to treat a brain disease like alcohol use disorder. And the first step is recognising that recovery is possible and that treatment often involves both medical and psychological approaches. So let's explore some of the most effective treatments. First of all, there are an array of medical treatments, which include medications for AUD. There are several medications approved by the FDA to help people with alcohol use disorder manage cravings and reduce the desire to drink. Now remember, I'm not a doctor, I'm just listing the information, and if you are interested in any of these pathways, please do talk to a qualified medical profession to work out whether or not they will be helpful for you in your situation. The first one is commonly known as antabuse. There are various names out there, but I think antabuse is the one that most people would recognise. And this causes unpleasant reactions when alcohol is consumed. And the theory is that it helps people deter from drinking. The next one is naltrexone. That reduces alcohol cravings by blocking the effects of alcohol on the brain's reward system. Another medication is Campral, which can help to restore balance to the neurotransmitters in the brain, reducing cravings and anxiety. And the last one I'm going to mention today is Topamax, a medication that may reduce alcohol consumption by affecting the brain's reward pathways. And as I say, if any of these you think that might be helpful to you, talk to a doctor. In addition to medications, therapy is an essential part of recovery. That could be cognitive behavioural therapy or CBT. And it can be particularly effective for AUD because it helps individuals recognise and change unhealthy drinking behaviours. CBT helps clients identify triggers and stresses and teaches strategies for coping without alcohol. So as well as medications and therapy, another massive way of addressing alcohol use disorder could be joining a support group. So this could be, there's lots out there. The most famous one is Alcoholics Anonymous, or AA, and other 12-step programs, and these offer vital support during recovery and ongoing support as needed. These groups provide accountability, encouragement, and community to those struggling with alcohol use disorder. You could give AA a try, set aside any ideas you might have about it and just see what you think. They recommend going to a few meetings to see how you feel about it. Don't judge it just on one or two and keep an open mind. Of course, there are other groups out there as well. There is LifeRing, Smart Recovery, and I'm sure there are other more localised support groups in your area. So do check them out. For some people, especially those with severe AUD, inpatient rehab programs provide a structured environment where they can focus solely on recovery. Outpatient programs allow individuals to receive treatment while living at home. So, alcohol use disorder sounds pretty depressing. It's described as a chronic, relapsing brain disease. But this podcast is all about hope and recovery. Remember that alcohol use disorder is treatable. There is lots and lots of hope. There are lots and lots of stories out there of people who have overcome this. And one of the most important things is to remember that you're not alone in your journey. Whether you're in recovery, just curious, slightly concerned about your drinking, but thinking, oh, it's nothing that serious, or you're supporting a loved one, or just taking a break, there's always hope. It might take some time, particularly if your drinking has become very heavy and chronic. Perhaps you keep relapsing, you feel really frustrated with yourself, but that's part of the recovery cycle, so don't beat yourself up about it. It might feel right now that you're on a difficult road, but recovery, no matter what level you're on, is possible. By treating AUD as a brain disease, we can approach it with compassion, understanding, and the right medical support. So if you do feel that you need some medical advice, please seek it out today. So it's been a bit of a longer one today, but I think it's been important. And I want to thank you for tuning into the Alcohol Recovery Show. And if you found today's episode helpful, don't forget to subscribe and share it with others who may benefit. For more information and resources, you can visit our website at winspress.com. There are lots of free resources there, as well as books that we have available to buy. Remember, recovery is a journey, not a destination. Keep going, and we'll be here with you every step of the way. And until next time, take care and stay strong. Bye for now. Bye.